So hey, let me just kind of position what we're doing today and kind of what we're not doing today. So this is an overview. It's only a couple of hours. So HIPAA is a very detailed and very confusing set of regulations. They wrote the regulations. There have been a lot of things that have changed over the years, so there have been interpretations and things like that. And then, of course, we just had the HIPAA Omnibus rule come out in January, and it was an update to an interim rule that had come out in 2009. So there were some significant changes to it, but there's just an awful lot of detail here, and we just simply don't have the time to get into all the detail. The other thing is that what I'm trying to focus on today is to give you some resources to use and send you some places afterwards where you can get some detail, and we'll also send you some things. Wendy mentioned things like the Business Associates Agreement. That's a legal document. I'm not a lawyer. And anything I say here today is simply based on my experience in the IT world, the compliance world, having run IT in a hospital. So we're talking about a law. We're talking about actually several laws, but it's not legal advice. So if you're going to get to the point where you're going to do agreements and things like this for your own company and recommend them to your clients, the document that Wendy was mentioning has a big disclaimer at the top of it, and I'm kind of putting the same verbal disclaimer on this. Anything you see in here today that you might want to put into an agreement or have some sort of legal relationship, please have it reviewed by a lawyer who's familiar with your circumstances. So that's not me. There's no lawyers in this room. So there's nobody here that can give you that kind of advice, and we're also probably not familiar enough with your companies to make it worthwhile. So we're doing the mini boot camp, and we're going to give you the resources today that can help. And Brian, I'm having a problem with the remote again. Sorry. Okay, if you want to hit the next button, thanks. So this is me for those of you that don't know me. I've been in the IT world for over 30 years. I know I don't look that old, but I started back in 1980 as an Apple dealer. And when you were an Apple dealer in 1980 and you went to a meeting with Apple people, it was Steve Jobs. So I go back to that point in the computer industry. That got us rolling. A lot of changes, a lot of things that happened. One thing I'll point out to you is that my HIPAA background came out of a meeting similar to this. I was at a reseller gathering in 2003 in Baltimore and heard another reseller get up and talk about this new HIPAA regulation that was going to come out in 2005. That was the security rule. And I left that, went and got a certification, started marketing it to our local community. Within 30 days, I was partnered with a CISSP, security specialist, and we did an assessment of a county, and we charged about $30,000 for that. Then within a couple of weeks, I had an offer to become the CIO in a local hospital. And it was all because of HIPAA. Now, HIPAA was new at that point. It was mysterious. So there was an opportunity there, and now there are more people that are familiar with HIPAA. But I'll tell you, based on my work with a lot of these healthcare practices, many of them have not done a good job, and there's a big opportunity still out there. I'm certified, got a lot of certifications, and that's not just to put a bunch of initials after my name. There's some reasons to do this. The HIPAA stuff, I think, is obvious. I became a certified security compliance specialist because it's not a huge leap to go from healthcare into financial and other industries that have regulations that don't protect health information, but they protect financial information or personally identifiable information. So if you're going to be in healthcare, that's great. If you go and look at finance, you're going to see a lot of similarities. And that was one of the things that we do. Our company also does business continuity planning, which is separate from the HIPAA practice. And business continuity is a requirement for financial businesses and also a lot of other types of companies. And sometimes it's not a law, it's not a regulation, but it's a contract. So a company that wants to do business with you will not do business with you unless you have a good business continuity plan, because that protects them. So those are some of the other certs that we have. I'm involved with CompTIA, which is the Computing Technology Industry Association. Their headquarters is actually very close to where I'm standing. And CompTIA has different communities. So I chaired their IT security community. I was on the development team for the IT trust mark, the security trust mark that CompTIA has, and my company holds it, and the last two companies that I worked for, we also earned it. So these are things that give us credibility in the marketplace, and I'm showing them to you not just to try to impress you, but to show you that as you go to market, there are ways to show that you're credible without having to get a lot of references, and even if you're starting out, having some certifications is a quick way to get some credibility. So I got to work in this hospital. First day as the CIO, and they showed me to my office, and it was next to the morgue, because they don't give the CIO the front office with a great view and where the public can see him. And I had said that I needed a bookshelf in the office. They asked what I needed. I said, really don't need much, I just need a bookshelf. And my bookshelf had a label on it. Autopsy specimens. So when I said that I needed a bookshelf, somebody went next door to the morgue and took the autopsy specimens off of the bookshelf and put it in my office. That was what I called the glory of healthcare IT. So let's talk about HIPAA. So first of all, HIPAA has one P and two A's. And I can't tell you how many times I've seen it spelled differently. Almost every misspelling is two P's and one A. So I'm a bit of a stickler with this, and I just want to remind you how it's spelled and what it stands for. Health insurance portability. The other thing I hear from people is it's health information privacy. No. Health Insurance Portability and Accountability Act. And it goes back to 1996. 1996 was a time when if you went from one job to another job, if you wanted to move to the other job, you had to find out if their insurance company would cover you before you moved to the other job. And the Health Insurance Portability Act forced the issue. So with the exception of a few prior conditions, your health situation as it is now, the other insurance company doesn't necessarily have to take you, but unless you've got some specific conditions where they don't have to take you, now you can move from one job to the other and know that you're going to be insured. So HIPAA morphed over the years. One of the things that it did was it simplified the billing. So in the old days, the billing was done differently for each insurance company. So if 4 people came in for a treatment and they were insured by 4 different companies, the billing office for that practice would have to fill out different forms and use different codes for the same treatment. And part of this was to keep people confused, to delay the payment process. Not every payment that was denied was going to come back, so the insurance companies were making a lot of money on these errors. And the federal government came in as one of the early parts of HIPAA and said, no, you're all going to use the same codes. And by the way, who's the biggest insurance company in the United States? Medicare. So they said, you're going to use our codes. And that forced the issue. It simplified things. Now 4 people came in for the same treatment, 4 different insurance companies, 1 code. So it simplified it. The payment process sped up. That's HIPAA in the old days. What HIPAA morphed into is that in 2003, the privacy rule kicked in. The privacy rule governed all protected health information. So what's protected health information? It's the combination of the diagnosis and the patient's name. It has to be identifiable, or the treatment. So we had everything that was written. Paper charts were the big thing back then. Everything that was verbal, so a doctor and a nurse or 2 doctors talking about a patient, now had to be outside of the earshot of other patients. Because in the past, it may have been etiquette, but now it became a legal violation if another patient overheard what was being said. Whoops. And then electronic. There wasn't a lot of electronic data back then in the sense of EMR and EHR systems, but people were using programs like Microsoft Word to write letters about patient care, and they were sending emails about patient care. Faxes back then were really, at that point, really paper to paper. Paper into one machine, paper coming out of another machine, and now all that's changed. But back then, the privacy rule kicked in and covered everything, and then 2 years later, 2005, the security rule kicked in, which not only focused on electronic protected health information, ePHI, it also had a complete framework that said these are the things you will do, and then they had implementation specifications. Some of the frustration with HIPAA is they didn't go into a great deal of detail as to how to do things, and that was intentional. We're going to talk about that. So 1996 HIPAA kicked in, 2003 the privacy rule, 2005 the security rule. Not much changed. There were some enforcements, there were some things that were interpreted, but HIPAA really didn't change until 2009 when the HITECH Act was passed. Now the HITECH Act was part of ARRA, A-R-R-A, which was the American Reinvestment and Recovery Act, otherwise known as the stimulus package. So when you talk about these types of things on the news, you hear about the stimulus money. That's where HIPAA came from. I'm sorry, that's where HITECH came from. And HITECH changed HIPAA with some things. It's also the law that funded the ePHI incentive program, the Electronic Health Records Incentive Program, which is what funded electronic medical records for doctors and hospitals. So the HITECH Act was the funding act for the ePHI programs. It also made some changes to HIPAA because $36 billion was put into the funding for the electronic medical records. There wasn't a lot of news about the HIPAA changes. We're going to go through what those were. So the way the government works, and I don't want to hear any comments about the government and working being in the same sentence. The way the government works is that a law is passed and an agency is designated to enforce the law, to manage it. So U.S. Department of Health and Human Services does HIPAA. There are departments within HHS that get more specific into certain areas of HIPAA. So what happens is the law is passed, the agency is told, you're going to write the rules. The rules normally take a year, maybe two to come out. So the HITECH Act came out in 2009. There was an interim rule in late 2009, which had certain requirements in it that changed HIPAA. Data breach and some of the other things were changed a little bit. And that interim rule was in effect, and we're all wondering, where's the final rule? And what happened was that it went from 2009, 2010, 2011, and the rule was being written, and then when they looked at it and they were doing some estimates, they found out it was going to have an impact of more than $100 million. So now it had to go to the Office of Management and Budget. Normally that takes 30 days. It went in March of 2012. It didn't come out. There were all sorts of questions about why that happened. Was it tied to the election? One of the things about the HITECH Act is that people related it to Obamacare, which is the Health Reform Act. Totally different. They had no relationship other maybe than some similarities in timing under the same administration. But we were wondering, you know, if the president didn't win the election, was that going to affect this and so forth? We don't really know what happened other than towards the end of 2012, the head of the Office for Civil Rights from the Health and Human Services Department said that we're working on the law and or the rules, and they will come out eventually. Then in January, boom, January 17th, they hit with no warning, 562-page document that updated HIPAA, and that's what we're going to go through today. There's an enforcement deadline of September 23rd of this year, so just a few months from now. And right now, what they've got is the rules are published, business associates have to comply, there are other portions of the rules that have to be implemented, and they're simply not enforcing the rule until the September deadline. So when we talk about the September deadline, it's not something where people are going to stop working or all of a sudden you have to be out of the healthcare business or something. But what's going to happen is that you could have an audit or a data breach investigation the next day, and now you're going to be liable for a lot of penalties. So HIPAA. The privacy rule, so HIPAA's defined different types of entities. So it defined business associates as companies that aren't healthcare providers or payers that touch protected health information in the course of their work. Now, I know I'm dealing with a lot of IT professionals here, not just electronic. These are people that deal with paper. So think of a shredding company that comes to an office and takes extra copies and things that have been put in a locked wastebasket out to the parking lot, shreds them in a truck, comes back with a certification that the documents were destroyed. So they're physically touching PHI. So just think of PHI as anything that has a patient record on it. They required business associates to sign agreements. We're going to get into more detail on that. A data breach by a business associate was a problem for the covered entity because the covered entity, in other words, their healthcare client, they were the ones that had to report it and pay the fines, even if the business associate caused the problem. Business associates were out of reach of the federal enforcement process. The security rule protects electronic PHI, and it's broken down into safeguards, standards, and implementation specifications. So these are like the big headings, then the subheadings, and then the detail. And the thing that's important to understand about this is that even though we're talking about ePHI, electronic protected health information, over 50% of the rules are administrative. They're not technical. So they didn't write a ton of technical rules about how to protect data. They wrote rules that protect data, and as they were working on this, came out with a set of rules that has much less to do with technology, the technology itself, than the way that people use it. Thanks. So fewer than 50% of the rules have to do with the physical and technical security of the data. So we have PHI and ePHI. Protected health information has to be identifiable. Now we think of a name, obviously, and then their treatment or their diagnostic information. Could be something else. Could be a phone number that could be linked back to you. Could be driver's license number, social security number, some sort of identifier that can be linked back to the individual and also has some sort of treatment or diagnostic information. So people will say, you know, I went in the doctor's office and I had to sign my name in the register in the book when I got in there. That's a violation. No, it isn't. Back in the old days, before HIPAA, I used to have to go in and sign my name and why I was there. And you could go into the doctor's office and look down the list and look around the room and go, oh, I'm not going to sit next to that person, because you knew why they were there. That would be now a HIPAA violation because that's the identifiable information that has to do also with their treatment or diagnosis. And then electronic. PHI in some sort of electronic form, but when you think electronic, don't just think of data in a patient care system, because everything's electronic at this point. The images that used to be put onto film are now electronic. Voice images or voice records are electronic. Doctors used to go into a little room and dictate into a machine, and tapes would be sent to transcriptionists, and they had foot pedals to advance them and do all these kinds of things. All that stuff's electronic now. So everything is moving in an electronic format, and keep in mind, anything that has the identifiable information. So if it's an x-ray image that has your name on it, if it's a voice file where the doctor says, I just have seen patient so-and-so in the examining room, and here's what my diagnosis is, and here's the treatment, here's when I want the scheduled, here are the scheduled lab reports that I want, and then let's do a visit in 90 days. And it can be on any media. So when we think of media, we're typically thinking of like file servers and networks and things like that. Could be on a thumb drive, could be on the internet, could be out in the cloud. So it doesn't matter where it is or what it's on, it's still protected. So who's a covered entity? And this actually surprises some people when we talk about who is and who isn't. So healthcare providers, all the ones you think of, doctors' offices, clinics, hospitals, even pharmacies, labs, organizations like that bill electronically. So that's the trick. They have to bill electronically. So not everybody that has patient data is a HIPAA covered entity if they bill electronically. So if you have a doctor that's only taking cash for, say, plastic surgery or something, technically they don't fall under HIPAA. Now, they probably wouldn't be in business if they released the medical information and it became public that it came from them, but it's not a HIPAA violation. So basically what we say is follow the money. So you've got the providers that bill, and then you've got the companies that pay them. And here again, there's some quirks. So we think of insurance as the obvious one. So an insurance company that's going to take that electronic bill and then pay it back to a provider is a payer in the system. You have government, so you have Medicare that's paying for medical services. You also have private. So all the ones you can think of, you know, the Blue Crosses and organizations like that, United Healthcare and all the different health plans. One thing that surprises people is that if a company that has nothing to do with healthcare, and I say that has nothing to do, they could be in healthcare, but one that you wouldn't normally think of as being in healthcare, self-funds its insurance plan, now they're a payer in the system. So we've worked with school districts and we've worked with other types of organizations that self-fund their insurance, and the looks on their faces are just total shock when we find out what they're doing, and show them that they have to comply with HIPAA. They don't like it, first of all, but they're more upset that nobody ever told them that. And we're the people that are coming in sometimes years after the fact to doing this. Then there's a group of organizations they call clearinghouses, and a clearinghouse basically takes the data from the doctor's office, converts it over into a bill. So it's a service organization. So these are covered entities. These are the organizations that from day one have been responsible for protecting the patient data and liable if the data was breached. So covered entities can work with each other without having to have all these authorizations signed and go through any sorts of hoops in order to share the information. So when you go to a hospital, the hospital's allowed to share your information with your insurance provider because it's for T, P, or O, treatment, payment, or healthcare operations. So treatment, a doctor calling a specialist does not require your authorization for them to release your medical records. If you come into an emergency room, you're seen by the ER physician, you broke your leg, they bring in an orthopedist, you don't have to sign agreements that authorize the ER physician to talk to the orthopedist and so forth, because they're allowed to share your information for your treatment. They're also allowed to share information with covered entities, between covered entities, for payment. So the hospital can bill your insurance company because that's part of payment. And then operations gets into some different areas. We're not talking about surgical operations, we're talking about healthcare operations. And when we're talking about healthcare operations, there are quality assessments, case management, training, accreditation, but one of the things also has to do with legal. So if a hospital is sued for malpractice, or if a doctor is sued for malpractice, and you're the patient that's doing the suing, you can get your medical record and give it to your attorney. That has nothing to do with HIPAA. The release of it, you sign a release to get your medical record, you can give it to anybody you want. I don't recommend this. You can put it on Facebook if you wanted to. I mean, that's up to you. That's your medical record. But for the hospital or the doctor now to defend themselves, they have to share your health information with their attorney. That is governed by HIPAA. The attorney would be a business associate at that point. So understand what the hospitals, the doctor's offices, the payment organizations are allowed to do, because sometimes I'll hear from people, well, we're sharing information and we think they're a business associate. No, they're another covered entity. Or we're sharing information between two offices. Do we need to get releases? No, because again, it's for the treatment. So this brings up a lot of questions in terms of how people operate. One of the other fundamental requirements of HIPAA is that the information that is shared has to be the minimal amount of information required for whatever the process is. So minimal necessary is the term. So what you have to do is you have to restrict access. And when you're in a healthcare organization and you're setting up an electronic medical records or an electronic health record system, similar to an accounting system, maybe in your business, there are different levels of access that people can have based on their job roles. And the problem that you run into is that a small organization may have people wearing multiple hats. So they may be doing a lot of different things and may need a lot of access compared to a large organization where, for example, a receptionist may not need access to lab reports and test results. Excuse me, in a smaller organization, the receptionist may be told, don't schedule the patient, don't even let them come through into the examining room, for example, unless we know we have the labs and the test results back, and call the hospital and get those, if we don't have them. So some of these things vary based on the size of the organization and the job role, but you have to restrict the information. Go back to HIPAA's being more administrative than technical. So you do it by policy, and you issue policies, one of them very basic, that says we're going to only allow the minimal necessary access to patient data for each job role. And then when you get into the job roles, you then determine what level of access those folks need, and you assign it accordingly. And then you restrict access within facilities. So you can do this with literal physical access. You can put locks on doors in our electronic, well, we used to call it it's the Health Information Management Department, and they used to be called the Medical Records Department, where all the charts were and all those things. They had special locks on the door that only the people in that department could get into. I was the CIO. I could not go in there without being escorted. So that was a facility restriction that physically limited access to the charts. Within the systems, the software itself, you have restrictions, what people can get to. So if you're in Windows and you're setting up a network, you may give different groups or OUs, organizational units, access into different folders and parts of the network. That's still applicable to HIPAA. Then within software packages, you may also have different levels. You want to audit activities, not you want to, you have to. And this becomes a big question. I had a phone call yesterday from somebody who said, do I really have to turn auditing on? And the answer is yes, because HIPAA requires auditing. When you think about when you're going to need it, so audit trails just become these huge files. And to be honest, they're so big that if you don't know what you're looking for, they're really pretty meaningless. But at some point, you may be getting a letter that says you're being investigated, or you may be audited, and you have to be able to show that on a certain date something happened. So that's where the audit activities come in. And then snooping has become a problem. Snooping is a problem because you have people who have access to the systems because they have to. So here's the example. When I was a CIO in the hospital, we had to give nurses access to every patient's record. There was no way that we could manage the IT environment so that by having to find out that a patient came in and this particular nurse is assigned to that patient. How do you do that? It'd be a full-time job. And then what happens is reality sets in. A nurse calls in sick on one floor, another nurse floats over to help, and now we'd be changing the access. Doesn't make any sense, and literally could affect life and death by limiting somebody's access into the system, into that patient's record when they need it. So there's no way to stay ahead of it. But what we did do is that we did inform all the nurses that, and other people that were providing treatment, that the only records you're allowed into are the ones for the people you're treating, and we audit this. So we did have an incident where the ex-mother-in-law of one of our nurses came in as a patient, and the nurse was warned by the people on the patient care side not to get into the records. Now, this was one that we kind of knew what to look for because we knew the situation was happening, and sure enough, it happened. She snooped in her ex-mother-in-law's record. And very quickly, within minutes, she was in seeing the executives, and she was disciplined, and we sent a message out. Now, we didn't have to send it out through like email or anything. We just sent 2 people down to the cafeteria to talk about it. And that was like wildfire through the hospital. My phone was ringing the rest of the afternoon. Can you monitor everything we do on the computers? And my answer was maybe. And then I would hang up. So we wanted that mystery out there, but the bottom line was we did have the information, we did have the records, and we were able to prove this through the auditing capability of the software. Snooping became huge in Los Angeles when Britney Spears went in. She went in twice. I think one was physical and the other was, let's be nice and say, not physical. And they had 13 people at UCLA Medical Center who were fired for snooping in her record, and 6 doctors were suspended. So this is audited, this is enforced, it's all over the internet. And again, it's not necessarily snooping. And one activity in one practice may be snooping, and the same activity in another practice may not be snooping. And it gets down to what's appropriate. So it's up to the practice to determine what's appropriate, define it in job roles, and then through auditing and training, make sure that people don't do it. So business associates. What's a business associate? First thing is, what isn't it? It's not a covered entity. So a covered entity is, again, an organization that bills electronically for healthcare services or that pays for it. So business associate is another type of organization, and there are different types, that come in contact with PHI and ePHI in the course of their work. So these are some examples: shredding companies, paper storage companies, IT companies, electronic health record software companies. Now, they're not covered, or they're not business associates because they wrote the software. They're business associates because when they set it up and support it, they're using live patient data. So it's not just the fact that they wrote the software. Copier vendors. Now, back in the old days, copiers were copiers. Put a piece of paper on top, press the button, and a bunch of paper came out the bottom. That's all they did. Now copiers are all hooked up to the network. They're the fax machine. They're scanners. They're sending data either to an internal hard drive on the device itself or up to a server. So now you've got companies that in the past were only dealing with paper, and the most they might see would be a crumpled piece of paper with a patient record on it that they may be coming, if they do the repair on the copier, to fix. But now there's a lot of data that they have access to in the course of their work. Lawyers and accountants you wouldn't normally consider to be healthcare related, but they are. Every hospital, every doctor has a lawyer. And if they've been sued for malpractice or for some other reason, they've had to share patient data with the attorneys. When an accountant comes to an IT company like yours and does an audit, they take the transactions, the records of your sales, your purchases, your sales, and all these things, and what do? They track them through your accounting system to make sure that all the debits and all the credits and all the things hit the right chart of accounts, and that the bills were paid, and that it came through receivables and all those things. And they do those audits because you want to get bank loans, and you may have to prove to other companies, if you're doing business with any of the distributors, they're going to want to see a financial statement and an audited financial statement if your request is high enough, your request for credit's high enough. Doctors do the same things. Hospitals do the same things. So what they'll do is the accountants will come in and they'll take the patient record. And they'll take the patient record and they'll track that transaction. So the patient paid the copay, did the insurance pay the balance? Were all the accounting transactions done properly, so that they can come up with a financial statement for the hospital or for the doctor's office. So they do audits as well. So accountants and lawyers now are business associates, and they also provide opportunities for you to sell them services because now they have to comply just like you do. And then collections agencies. So you have the provider and you have the payer, and then you're in there as the patient. So if the payer doesn't pay the provider, collections agency is going to come to you. Collections agency, even though they're tied in with payments, they're not covered entities because they're not providers and they're not payers. So a collections agency is another type of organization. So when we look at this, the first thing I want to tell you is, for this top section, look at these folks as opportunities, because as business associates who now have to comply with HIPAA, they have some of the same challenges that the healthcare providers that you deal with also have to face. So now you've got not just an opportunity to sell into healthcare and all the ones we think of, but to sell your managed services and compliance services to these business associates. Now, in the new rule, the HIPAA Omnibus rule, they clarified some things. And they clarified them much to the consternation of some of the people in the IT industry. So they said that if you're storing information, and they didn't also tie it just to IT, but if you're storing information, even if you don't look at it, we consider that you're maintaining it and you are now a business associate. So there are companies that store paper records. And you'll see these white file boxes that get stacked up, and a truck will come by and pick them up, take them to a warehouse and catalog it, because healthcare has retention rules. So they can't just shred old records. They have to keep them for 7 years. In fact, they have to keep them, in some cases, for over 20 years to be compliant with the retention requirements. So those companies said, well, we never open the boxes. We never see the patient records. So it's up to the practice to tell us to go get a box off the shelf because they need a medical record in it, but we never touch the records. Those companies were told the fact that you're maintaining them means that you're a business associate. Data centers. So there are different services that data centers offer. Some of them offer only rack space. In fact, there's a company called Rackspace. And what they do is they have empty racks in these air-conditioned data centers, these big warehouses, and they have multiple internet connections, multiple power grids. They've built all the infrastructure to secure and protect your data in the form of you're not going to be affected by a power outage. They've got huge generators. You're not going to have to put supplemental air conditioning into a closet for your servers because they have all that. So the data centers will rent you space in the rack. You put a server in that rack, excuse me, and you pay them a rental fee on a monthly basis, basically for just the space that you're using. The rental fee includes all the air conditioning and all that stuff. You also have data centers that host. So the data center has the same racks, but now the racks have empty servers on them, and you're renting the space in the server. So you're actually renting the storage space. You don't have to put your own server in there. In each case, they're going to tell you they don't have the key to the rack, or if your data is encrypted, or if it's behind a firewall or whatever, they don't have access to your data. Same thing with online backup companies. Online backup companies, and there are a lot of them in this industry, and they all want you to white label their product and go out and sell the online backup to the clients and charge a monthly fee. Those companies will tell you the same thing. Well, everything that comes to us is encrypted. We don't have access to the data. Then you have cloud companies. So cloud is a very generic term, but I'm going to be more specific and talk about things like Microsoft Office 365, a company like Intermedia that does hosted exchange, Google Docs or Google Office, those types of things. So now the rule is that if they maintain the data, even if they don't look at it, they're now a business associate. Even if it's encrypted, even if it's locked in cabinets, and even if it's in sealed boxes. So this has become a huge issue since January, because the first reaction from everybody in this business was denial. We don't see it. We don't have to comply. That's stupid. You know, they're going to change the rule. Well, no, they reinterpreted a rule because this was not in the interim rule. This came out in the final rule when they put this term in about maintaining data. But to be honest, it makes sense. Because if you're the business associate and you're going to resell somebody's online backup service, don't you think they ought to be compliant too? You're telling your client, the healthcare provider, that you're securing everything, and now the data that you're taking, you're putting back into somebody else's infrastructure, and how do you know that they're compliant? This new rule says that they have to be compliant. There's another category. So we have covered entities, and then we have business associates, and we also have conduits. Well, what's a conduit? I said a business associate isn't a covered entity. A conduit isn't a business associate. If you're simply moving information and it doesn't stop, and when we say stop, stop in a real persistent way. I'm not talking about the mail truck stopping while the driver has lunch, or the paper, the envelope, stopping in a warehouse long enough to move from one bag into another bag and then get out on the truck. We're talking, when we say a business associate has to store the information persistently, that means that it's really going to be stored. So if they're simply moving it, and we're all patients, I would assume, and we've all paid a doctor's bill, our copay, and then the insurance company will pay the balance. We get this EOB, explanation of benefits form, or we get a bill from a hospital or doctor's office that details the treatment. So there's our name and there's our treatment. The organization that brought it to us doesn't have to comply because the odds are huge, really huge. They're never going to open that envelope. What are the odds of an envelope getting crunched in some postal machine? Maybe in our lifetime it's happened a few times, but really, really slim. So they don't consider it to be a high enough risk to force the Postal Service to be considered a business associate, nor FedEx and UPS. Now, FedEx and UPS aren't moving these bills around, but they're doing a lot of lab stuff. So I once had to have a lab test. I got a package. I had to blank, and then put it back in the package and send it to a lab. So that's an example of them moving something. My name was actually on the outside of the package, but they didn't know it was inside. They probably wouldn't have taken it. But that's the type of thing where these companies are moving this stuff. They're dealing with it all day, every day, but they're not a business associate. Now, here's the problem. When we get to electronics, when we get to electronic data, internet service providers always try to claim that they're conduits and they're not business associates. Many of these internet service providers offer you other services. Use our online storage, use our online backup. So if they're doing one of those services and they're doing more than just promoting or just moving the data, now they're a business associate. So they can't hide behind the fact that they are an ISP if they're doing these other things. Those other things trump them being a conduit. So there are organizations that will come in contact, casual contact, with protected health information. And there's guidance out at the Health and Human Service website that says a janitorial service does not have to sign a business associates agreement. Even though the janitor's in an office and cleaning things up and somebody may leave a patient record out on a desk, that's what they're calling incidental contact, and no, they're not a business associate. Now that's different than, say, the shredding company. The shredding company, where they're going to come and unlock the locked wastebasket, take all the paper, the extra copies and lab reports and things like that, they are a business associate. They're not a janitor that's just kind of walking by this stuff. They're somebody that's really dealing with it. Contractors or repairmen. If you have somebody come in to do some electrical work or fix a device or something that's not a medical device and doesn't have electronic data on it, just the fact they're walking through your office doesn't mean that they're a business associate. You should be careful. If you're a healthcare provider or if you're an IT provider and you're going to have protected healthcare information under your in your facility or in your control, you want to protect that, but it doesn't mean that everybody that's walks in the building has to be a business associate. There's some special cases, medical implant companies, and there are some other types of companies that, on specific guidance from the Health and Human Services Department, are exempt from this. So somebody from a medical implant company can actually be in the operating room while the doctor's installing the new version of the artificial knee or whatever, and they're not a business associate. There's some special rules that affect them. And that's tied in with the fact that they're FDA, and there's some other things that also do this. This slide may surprise you and may seem contradictory, but HIPAA is not a comprehensive privacy law. Go back to who's a covered entity. So you have the people that are billing for healthcare electronically, and then you have the payers. But it's not comprehensive in the sense that not everybody that may have your health information has to abide by HIPAA. So if you're going to send, if a doctor's office will send your information to an insurance company, a payer, that insurance company is covered by HIPAA because they're part of the payment process. But think about this. If you're in a car accident and the doctor is going to send your health information to your car insurance company, they're not a payer in the healthcare system. So that's an insurance company that would be holding your data, and it's not a HIPAA relationship. Now, again, there's confidentiality and there are other rules that may apply. And one of the things that we're going to talk about here in just a second is that state laws may also apply to some of this stuff. But understand that HIPAA is not all-encompassing, and not every place or every organization that may have information about you that can be identified and relates back to your treatment or diagnosis is governed by HIPAA. So you've got your providers and payers, and then California is the example I'm using here, but there are other states too that have said, we're going to make this more comprehensive. And in the case of California, the data breach law in HIPAA says that they have until that a provider that has breached data, and soon business associates will be liable for this also, has to report it to the patients and then even up to the government at a certain level within 60 days. That's in the HIPAA data breach rule. California changed that to 5 days. Same rule basically, but they cut it to 5 days. So it's different rules, and this is one where you have to be very careful to understand your environment and understand what may be going on in your particular state. I'd mentioned that I'm involved with CompTIA. One of the things that we did back in February was we went to Capitol Hill, and we were lobbying for a centralized federal data breach rule so that the states didn't all go crazy and come up with their own rules and make it very difficult for people to do business. So we're working on that, but at this point there are 46 states that have data breach rules which are separate from federal legislation and in some cases have nothing to do with healthcare. But it's something that you should be taking a look at. So now let's talk about the HIPAA Omnibus final rule. January of this year, it changed the data breach law from the interim rule. So the old data breach law said that if a device is stolen, think about a stolen laptop, just put that in your mind. If a laptop is stolen and it has unencrypted patient data on it, that you could claim that since none of the patients were harmed, and harmed would mean anything from financial to reputational, whatever, that if they weren't harmed, it wasn't a reportable breach. So they had what they called the harm standard in there. Well, one of the things that happened was that things like laptops were being stolen, patient data was being stolen, the patient data was being used now to defraud Medicare. But the individual patients weren't harmed. So in the narrow wording of the interim rule, that wasn't reportable. So the data was being used for illicit purposes, but it wasn't reportable because the patients themselves weren't harmed. So they took out the harm rule and said, if data is lost, it is now presumed to be breached. That's huge. Now there are 4 exceptions to that, but what it really gets down to is that there's no longer just this wild card that says, well, we don't think anybody was harmed, so we're not going to report it. So one of the exceptions is that if you got the device back, which is unlikely, the FBI statistic is that only 3% of lost laptops are recovered. But if you did get the device back, you can have it tested forensically to determine if the files were accessed. If the files weren't accessed, then you can claim that it's not a breach. But that's pretty narrow in terms of how many laptops are lost versus how many are recovered, and then what are the odds? First of all, you have to pay a service to do the forensic test and then come back with the right answer. So it's much more difficult to claim that a data breach isn't a data breach. It changed the patient access to data. So the Omnibus rule allows patients to get their data in electronic format and has some guidance in there about how to do it. So for instance, if somebody's using Allscripts or NextGen or any of the big EMR packages, eClinicalWorks, whatever, you can't give the patient a data file that they need that program to open, right? That's obvious. So these programs have the ability to export your records in PDF format, and they even put in the rule that PDF's an acceptable format. Everybody can read a PDF. So that's one of the changes. Health organizations are like IT organizations and many other businesses where companies will give you marketing funds to go out and market their products. So a healthcare organization could get funding from somebody that does, say, defibrillators or pacemakers or artificial knees or shoulders or gastric bands or whatever. That's what the company makes. And they're going to pay a hospital or give them marketing funds to go out and market that service. So they're going to sell more. Well, that used to be a gray area. With the new rules, now the patients have to authorize that, and the authorization has to be specific. So it's got to be specific towards a particular function or a time period and be very clear. So it's not just you can sign off your rights forever so that they can continue to market to you. And then genetic information can't be used for underwriting purposes. Now, this isn't so much guidance for you to go out and sell technical services, but we're all patients. And every one of us has some genetic history, and there may be things in the genetic history. You just saw it yesterday, I think it was Angelina Jolie, where she had the breast operations because she was tested and genetically she had something like a 90% chance of getting breast cancer. Well, that information is now available, and what the law says is that it can't be used for underwriting purposes. So in her case, using her as an example, the insurance company couldn't have gotten that information and then said, we're not going to cover you, or here's what, some exorbitant rate, which she could probably pay. The rest of us couldn't, but they're not allowed to do that. So these were some of the highlights, but the big ones had to do with business associates. So now let's talk about the HIPAA security rule. Protects ePHI from two things: loss or unauthorized access. You really have to understand IT systems to be compliant with that rule. Most medical practices, particularly the smaller ones that I've dealt with, don't understand IT systems and don't have people on staff that do, so that they either need to outsource it, or in some cases they've tried to do it themselves, band-aided it. It really doesn't work from a compliance standpoint. It's confusing. The security rule is really confusing to covered entities. And I'll also tell you, it's also confusing to people like those attorneys and accountants and shredding companies and other business associates that aren't in the IT world. And then the sad fact is it's been largely ignored since 2005. So when we talk to practices now about their current level of compliance, they never did anything when the security rule kicked in 2005 to be compliant. So I said this earlier, the structure is safeguards, standards, and implementation specifications. So here's an example: administrative safeguards. So the administrative safeguards, and then there are physical safeguards, and there are technical safeguards. Those are the three big headings for the HIPAA security rule. Below them you have standards. So you have security management process as a standard, and then below that you have implementation specifications like a risk analysis, risk management, sanction policy, and then an information systems activity review. So again, you have the chapter, and then you have the subheadings, and then you have the details about what's required. This is really confusing to people because they put the rules out, and then they said, well, some of them are required and others are addressable. Some people took addressable to mean optional, and it doesn't mean that. So required, I think we all agree what required is. You have to do it. Addressable says, here's what you should do. And they even say must do. But if you don't do those things, then you have to come up with an alternative way to accomplish the same goal. So addressable, first of all, is not optional. If you leave here today with anything, if you're going to remember just one thing, remember that addressable isn't optional. It has to be implemented if it's reasonable to implement. Now, here again, these are kind of vague words, but I can tell you through some practice and through some enforcements where people have gotten caught. You have to implement an alternative equivalent if you're not going to do exactly what they say. And then if you do that, you have to document why you did it and how you did it. So you can't just say we aren't going to do something. We don't think, that's addressable, so we're not going to do it. You're going to say we're not going to do that HIPAA says specifically, but here's what we're going to do as an alternate, and then you have to document that. So if you don't do those things, you're in violation. So here's an example, and I just heard this recently, and I've heard it many times before. Well, it's too inconvenient for us to have our systems automatically log off, because then when the doctors go in the examining rooms, they have to log back on. It's a real pain. It takes time. They aren't paying attention to the patient, slows them down, yada, yada, yada. And we hear all these excuses why automatic log off is inconvenient and interferes with their ability to deliver their health care services. And automatic log off is addressable. Again, it's not optional, it's addressable. So what's your choice? So I said recently to a practice, that's okay. You don't have to do it. They go, really? We didn't think you were going to say that. I said, no, here's your choice. So when a doctor goes into the examining room, there can't be a patient there. So the doctor's going to have to come in. If the system's live and it hasn't logged off, the only people that can walk into a room first would be the people that have the rights into that system. So you can't have a patient care system or an electronic health record system sitting there live and only the patient in the room who could walk over and start messing with it. And there are a lot of reasons why you wouldn't want to do that. Not just snooping, but you don't want them in like changing blood types and things like that. Could be a little more than inconvenient. So you've got this option to say, okay, we're going to not allow the patients to go back into the room, can't go to the examining room from the waiting room unless the doctor's in there. Or unless you have another staff member that's authorized, escort them and sit there for every minute that they're in the examining room waiting for the doctor. They go, well, that's crazy. That would cost us a fortune. I go, well, those come up with a third alternative. I don't know of any other way to do it to keep a patient out of the system if you're not going to shut it off. And they said, okay, if it's in an examining room, what's a reasonable amount of time before the log off? So that becomes a variable answer, by the way. And if you're going to have devices close to patients or close to the public, they have to have a short period of time before they do an automatic log off. If they're in a doctor's office, when I mean a doctor's office, the doctor's personal office, way in the back of the practice, down a hallway without patient traffic and all those kinds of things, you could extend that and not have a lot of risk that a patient's going to get it. But it varies based on literally where you are in the office. So understand that if you're going to do something that's not required, you have to come up with an alternative to that rule, to that requirement, and you have to document that you're doing that. Where do you get guidance? Now, I don't expect you to write this down. We're going to send the slides out after, right? Okay, so there's some links down here, and these will be hot links when you get them on the slides. This is not one page. I actually had to copy the titles of 6 pages to put them all on one slide. So these are separate documents that the U.S. Department of Health and Human Services has put out, and their intended audience is more medical practices than IT companies, but there's still a lot of good guidance here. Security 101. So it's basic IT security, and this is all in the security series, so we're talking about electronic data. Security standards and administrative safeguards, physical safeguards, technical safeguards, organizations and policies, how you set up your organizations and how they link to security, and then the policies, and then some basics on the risk analysis. And this is guidance for small practices with the idea that they should be able to do this themselves. I will tell you that a lot of people that have done this have thought they had done a good job because they followed the guidance, but it's safe to say that what they've done really wouldn't stand up to an audit or to a data breach investigation. So it's not something that is for anybody to use. You have to be pretty savvy. Again, if you're in the security rule, you better understand systems and how data is stored and how it moves. How many people here have heard of NIST, N-I-S-T? Okay, not all of you. So it's the National Institute of Standards and Technology. It's another government agency, not under Health and Human Services. It's under Commerce. And what that organization does is it writes guidance for other organizations, other government agencies, and also for the public. So everything that NIST does is public. It's the guidance that another agency, so like the Federal Aviation Administration or one of those that wants to know what's the proper way to encrypt data, they would go back to NIST and find the guidance, the specific guidance on NIST. So NIST writes a lot of publications, and they give you the details that HIPAA doesn't give you. So HIPAA will say you have to protect your devices from malicious software, period. What does that mean? So NIST will have the guidance about the type of software that you would put onto a device, and HIPAA doesn't say, for example, you have to have a firewall. You're not going to find firewall in HIPAA. But when you look at the NIST guidance, then you're going to run into the ability here with NIST to go in and find the details of the type of protection you need to have at the perimeter of a network. So NIST has, in this case, this is a guide for conducting risk assessments, and it's 95 pages. So HIPAA has very little. It says you have to do a risk analysis. Brent mentioned before we started, HIPAA doesn't even say how often to do it. NIST has the guidance as to what goes into a risk assessment and how to do it. So this is the information that gives you what is typically missing from HIPAA. The more important thing is that when you're being audited, if you follow NIST, the auditors are going to accept what you've done. So the way that I describe it is there's the wrong way to do something. There may be multiple right ways. And in the IT world, one of my biggest challenges was that when I've gone into companies that have had 4 and 5 engineers, after I get to know them a little bit, I can tell a server that each one's set up because they have their own style and they do it differently. And the problem is that becomes difficult to support. It's not a standard. One person likes to do something one way, another person likes to do it another way. So there are multiple right ways that we can do these. Call it style. If you have different ways of doing something and you're not sure which one to use the NIST way. Follow NIST because that's the one that the auditors will also use as guidance to determine if you're doing the right thing. So I'm not telling you what to do or what not to do. I'm telling you that if you follow NIST guidance, the chances are much greater you're going to pass an audit or a data breach investigation. So NIST has sorry, here we go. Oop. We jumped. So NIST has several documents that relate really closely to HIPAA, and there's some other things that relate to some of the other rules too. One of them is they actually published NIST, they call them special publications. So if you're going to go out to the NIST website, we've got the link up there. You can also come to our website, semmelconsulting.com. We put these out for downloading. So these documents are guides, and the one for HIPAA, an introductory resource guide for implementing HIPAA, is 117 pages. So again, when you're reading HIPAA and you're going, oh man, what do they really mean by that? Go read the 117 pages that NIST has because they're the ones that really get down into the weeds. Guide for conducting risk assessments is 95 pages, and they have a separate document on the encryption of stored data, which is 40 pages. So that's 800-111, the one on stored data. So these guidelines don't tell you to go out and buy a product, a particular product. But they will say, for instance, for encryption, you need to have 250 AES 256-bit encryption, et cetera, et cetera. So now you go to the NIST guidance and you read that, and then you go out into the product marketplace. And there are a lot of companies that have encryption software, and all you're looking for is to connect the dots. You want to make sure that that encryption software, and some of them won't clearly say we abide by, or we're meeting the NIST requirement as outlined in 800-111, but if you know it's AES 256, then you go and you find the software that is AES 256. So it's just that simple. So here's some HIPAA myths and facts. And the reason I like doing this is that these are things that I hear and see, and here's what the truth is. And I back it up by even showing you in some cases where I found the answer. So any email message containing patient data must be encrypted. True or false? It's false. Okay? Because if you're emailing with within a secure system, you don't have to encrypt. So if you've got an Exchange server and you're going to send information from one desk to another desk and your network is secure, then it doesn't have to be encrypted. So the reason I'm saying this is the word any becomes very operative here. Okay, not any email has to be encrypted. So if you have a secure server or a secure network, and in some cases now the medical practices through the EHR programs have portals where they can send you a message within the portal that can be very detailed and have an awful lot of, all your diagnostic information in it. You're going to get an email that says log into the portal. So you're going to have to use your login and password to authenticate into their portal to read the message, but you never get the message. In other words, the message isn't really sent to you. You're getting sent an invitation to log in and see the information. Okay, and you have to have credentials to do that. So that's another way to do it. Now, what we're going to tell you is don't send unencrypted emails to outside addresses. So now if the system is, if you're going outside your system, then you want to encrypt it. And that also, so now let's go back to the example of doctors sharing patient information for treatment. So if you're doctor's office A and you're going to send doctor's office B information, that should be encrypted. And the reason for it is that even though both of you have the right to see it, you want to make sure that the transmission is secure. So you want to have that information encrypted. And there are software programs that will do encryption and online services that will do email encryption. Myth. I'm not allowed to send unencrypted email to a patient. True or false?
False.
Whoop. Why?
They request it. Because the information may not be medical.
Okay. If it's so let's qualify this. It is medical. It is identifiable, and it's medical. It's got their name and their treatment info in it. Okay? I'm not allowed to send it. That also is false. And here's why. And this is something where I don't do two things. First of all, I don't like putting a lot of words on a slide. And the second is I don't normally like the presenter reading the words on a slide, but this is important. This is new in the Omnibus rule. This is brand new. And this has surprised a lot of people. So page 5634 says, we clarify that covered entities are permitted to send individuals unencrypted emails even if they have advised the individual of the risk and the individual still prefers the unencrypted email. So the example would be that a patient says, please send me my email and my address is blank, blank, blank at Gmail or at Yahoo or at whatever. That's one of these web mail services. If individuals are notified of the risks and still prefer unencrypted email, the individual has the right to receive protected health information in that way, and covered entities are not responsible for unauthorized access of protected health information while in transmission to the individual based on the individual's request. Further, covered entities are not responsible for safeguarding information once delivered to the individual. This is in the Omnibus rule. Question?
Yeah, so answer really was true unless you have to do 20 other documentations with the person before you can send him the unencrypted email.
No.
The answer to that question was true unless I first tell him, please, these are the 20 things, these are the risks, these are the documents, sign them, then I will send you the email.
Well, no, I don't. Here's the reason I don't agree. It's not true, and that is that it's, again, a hard statement that I cannot send this unencrypted email to a patient, but you can if you tell the patient that it's not a secure way to do it and they say do it anyway. So you can do it. And then you document it, yes. So any request, yes.
Require that the patient signs off something, say, when you say document.
They didn't put that in. They don't have a sign off, but I would document it in some sort of it's a request for the patient to send them data. So healthcare organizations do have ways to document that, even in the EHR systems, to track the patient request to have their information sent to them or sent to a third party. The point is here that this used to be the answer was true because there really wasn't guidance, and it was something where a healthcare organization would say, well, no, since you don't have a secure email service, we're not going to send you your patient data. And here's what really happened. It really said if the patient has more rights to the data, then you have to deny them for some reason and make them jump through hoops to get it. Myths and facts. All data at rest must be encrypted. You're getting the hang of it. Okay? It's in HIPAA twice, not just once, that data must be encrypted. But it's addressable, and it's not required. And this is one where it's been a political hot potato. So when I say a political hot potato, HHS, the Department of Health and Human Services, that investigates data breaches, has seen where these data breaches come from. Go out, you can go out to what we call the wall of shame, which is where the HIPAA data breaches are reported, and it shows you how they happened. And it also shows you who did it. So one of the things it shows is, since 2009, 21% of the data breaches were by business associates. So if you're sitting in this room saying, now I have to comply, it's a real pain, it's going to cost me money, you know, et cetera, why do I have to do it? 21% of the data breaches were caused by business associates. This year it's over 30%. So people in this room, in the class, basically, business associates, are guilty of 1/5, now up to 1/3 of the breaches, they have to do something. That's too big a number to ignore. The other thing is that became political in here is they wanted to put encryption in as a rule. And in several of the drafts that get sent up for comment, they made encryption a requirement. Well, of course, the medical industry freaked out and said, oh no, that would be a financial burden to our doctors and our hospitals. You can't make them encrypt everything. And these folks won. So those requirements were taken out of the law. So here's what happened. The data breach rule was changed to say that you don't have to do encryption. Okay, it's addressable. If you don't do encryption and you lose a device, that's a breach. If you do encryption and you lose a device, not only isn't it a breach, you don't have to report it to anybody. So you don't have to report it to patients, you don't have to report it to the federal government. So they made encryption a get out of jail free card. So the answer to this question is no, not all data at rest. So we're talking about stored data, not as it's being transmitted like across a network or the internet, but if the device is encrypted, it's exempt from reporting rules. So the answer is no, it doesn't have to be encrypted. My answer is, but it should be for two reasons. One is obviously the data is more protected, and the other is the organization is more protected. And when we get into the fines, you're going to see some huge reasons that data should be encrypted. So now let's talk about business associates, a chain of trust. So examples, IT service providers, shredding companies, EMR companies, accountants, attorneys, data centers, insurance agents, contract transcriptionists. In our hospital, for example, we didn't have in-house transcriptionists. They contracted with a service and we sent voice files out to people who transcribed them and sent them back. This is one of those true like work-at-home businesses. So business associate. The contract that a business associate signs with a covered entity is simply a contract between two businesses. It's not a federal form. It's not, it has to have certain verbiage in it based on the rules and what the guidance that is published by the federal government says, but it's really a contract between two businesses. Just think of it that way. Either party can provide the other one with a contract. So even though you would expect the covered entity to give you a business associate contract, if you haven't signed one, and I hear from IT companies all the time, well, we've got 20 healthcare companies or clients and only 2 have given us business associate agreements. You can give them your own. Have them sign it. It's as legal as if they gave it to you. May have some different terminology in it, but it doesn't matter which way it comes. It has to include specific language. That's published on a federal website. It may include other requirements. Again, this is a contract between two businesses. Read it carefully because I've seen business associate agreements. One of them, I got a call from a IT company in Portland, Maine, and the guy was livid. I hate HIPAA. In fact, he said some other words that I can't say here about describing HIPAA. And I said, why? Why are you so upset? And I knew this guy. He said, because HIPAA requires 18-character passwords that have to be changed every 30 days. I go, huh? I said, where are you getting this from? Well, it's in this business associate's contract. He had a healthcare client that actually put that into a business associate's contract. Now, there's nothing wrong with doing that. I would say to him, I would negotiate this. Okay, you can negotiate 18 down to a more acceptable number. You can negotiate 30 days up to a more acceptable number. And if they say no, then you have to make a decision. Is it worth their business to sign that contract, which is no different than any other contract any other business, looks at. So don't think because it's a business associates agreement that it's going to not necessarily have some gotchas in it. And that's an example of one that you want to be careful of. So they published new guidance January 25th. That's out on a federal website. If you go out to HHS, just Google HHS and business associate agreement or business associate contract, and it'll take you right to that page. So the guidance is out there. Those are the terms that have to be in there. And what's important about that is that if you're signing a new business associates agreement, it should have the new wording because otherwise they're going to have to replace it. So you have the new guidance from January 25th. The new contracts should include that. And if they're existing contracts that you've had, so you could have had them back to like 2005. Business associate agreements don't have to be renewed every year or whatever. They have to be replaced by September 22nd, 2014. The reason this date is important to realize what it is or to understand what it is that people have confused this with the compliance deadline. And I've had people say, well, I have an existing business associate agreement. That means I don't have to comply until 2014. I'm going, time out. The 2014 date is for the medical practices and the business associates to clean up old paperwork and get the new guidelines in place, the new contracts in place. But everybody still has to comply by September 23rd of this year.
With these business associate agreements, now that with the changes, Office 365 falls under this. I mean, you're not going to call Microsoft and say, I need you to sign an agreement.
As a matter of fact, you are, and Microsoft will sign a business. So here's the thing. So the question was, if you've got a vendor like Microsoft is being used as the example, and you want to put a client up, a healthcare client up on 365, Microsoft will sign a business associates agreement. What they won't do is take a different one from every one of you in the room. They're going to give you theirs, and they will sign it. So it's a good question, but yes, and that's going to lead us into something else. So here's the final rule, some of the requirements. You have to sign the business associate agreements. You have to implement, this is for you folks, you have to implement full compliance programs, which is policies, procedures, and all the other things. You have to train your workforce. You have to deliver HIPAA compliant services to your healthcare clients. That may be different than the services that you deliver to clients that aren't regulated. You have to manage your subcontractors. This is huge. We're going to talk about this in a minute. And in the absence of an agreement, your compliance is by act, not by contract. An act simply means that if you're doing the services that make you a business associate, with or without a contract, you're a business associate and you're liable. So business associates are responsible for the compliance of their subcontractors. Data centers, document storage, online backup providers, cloud services. Your example of Microsoft would be one of the examples here. And they comply, even if they don't have access, they have to comply to the protected data. So on the slide, and it's not an error that the slide runs off the screen. On the slide, you have the covered entity. That's the client that you're facing selling them somebody's online service. So let's use online backup as an example. You're using one of the online backup companies, you're white labeling it, you're going out and selling it under your brand to the healthcare clients. So that's you with the business associate, I'm sorry, with the covered entity, you sign their business associate agreement, or you can give them yours. So now you have to sign an agreement with the cloud vendor because you're responsible that your vendor that you're bringing to the party is compliant. So you sign it with them, and I know this for a fact, they don't all have their own data centers. So they're going to store their devices, which are SANs and servers and all the things that they use to deliver their backup service. They're going to store that in somebody's data center. So they have to get a contract with the data center. And many of them, in fact, the smart ones, the good ones, don't just have one data center. What happens if the data center fails? How are they going to recover? So they have their data replicated in multiple data centers. So when you're looking at this, it's a chain. And every link in the chain that has the protected health information, even if they don't look at it, as long as they're touching it, they all have to sign business associate agreements. So you only sign with the people that are directly in front of you and the people that are directly behind you. So in your case, if you're going to sell one of these, using this example, you're going to sign an agreement with the covered entity and the cloud vendor behind you. The cloud vendor behind you is going to sign with you and the data center, or in their cases, multiple data centers, because they may have multiple data centers. Now, if the data center has something that's outsourced that relates to the protected data, they're going to have to sign the agreement with the cloud backup company and then whoever their subcontractor is. Now, this is difficult. People don't like it. It's annoying. It can be confusing, but here's what really happens. It makes sense. So if your covered entity is trusting you with their data, and you're going to trust this company to back up that data, you have to trust that that company trusts the data center they're storing the stuff in. And what HIPAA has done is that it's now made it a formal process to have the agreements in place. And the reason it runs off the screen is you don't necessarily know how far that chain is. In fact, this particular chain could come way over 4 or 5 more steps. Question?
My understanding of the rule is that every chain has to be as strong as that first link between you and the CE. And because of that and the confusion with like Office 365, who has a very tough agreement, but it might not. If the CE says you have to have an 18-character password and some of the crazy stuff, that there's, I guess, some further guidance forthcoming on that strongest link thing.
There may be. So the question was that if your agreement, using the example before that said that a business associates agreement may have specific requirements in it, and that would kind of fall downhill and hit everybody that's in line with that, then there may be further guidance coming. Right now, the clarity is that everybody has to have agreements in place by September and be compliant by September. So here's my guidance to you, and I think we're going to get to this, that if you don't have everything in place long before September, depending on what the service is, you're not going to be compliant by September simply because you're going to run out of time. So using this example, you have a covered entity, you're the business associate, and you're selling ABC's online backup service. An ABC company has said, we're not a business associate, we're not going to go through this stuff, we're not going to sign agreements, we're not going to comply. Your client may say this, we're not going to do that. So it doesn't matter whether it's specific to the agreement as a specific requirement in the agreement or whether they think they're going to comply anyway and put this stuff in. How long will it take you to go replace that online backup company, get new backups done, get the whole new service up and running? You can't wait till September 23rd to find out this isn't going to happen. So you need to be doing that now. Yes.
Another question. You mentioned in an earlier slide about incidental contact, and the contractor wouldn't be required. I'm thinking subcontractor. The first thing that comes to my mind is that guy that I send out to run Cat 5. Would he be this or would he be that?
If it's a guy running Cat 5 cable in a medical office, he would not be a business associate. He's really not going to be touching. First of all, I don't know anybody that stores their medical records above the ceiling or behind the walls or in the data closets. So really, when you think about it, in that particular example, that's probably a good one of the type of contractor that, yeah, walking through an office or bringing something to a desk, they may see something that's on a desk, but it's really incidental contact. They're not touching it. Another question?
So that chain that you're talking about, it just keeps going and going and going. So how do you know?
Okay, the question was, how do you know how long the chain is? Let me give you some guidance on that. Okay, first of all, there's a level of trust here where when somebody's signing an agreement, they're going to live up to it. These are legal agreements between businesses. So you have to identify all the subcontractors. You have to identify their subcontractors. How do you know who they are? You have to ask them. And there has to be a lot more transparency in this than there ever has been because of this law. You have to ensure that the subcontractors will sign the agreements and implement HIPAA compliance. You need to monitor the subcontractors' ongoing compliance or do not work with them. And here's the bottom line, and this is truly the bottom line. If you send the data, so if you're going to use an online backup company and you don't have everything in place with them, and you send them data, you just created a data breach. Think about it. If you send data to anybody that hasn't signed a business associate agreement with you, and I'm talking about a subcontractor, that's a data breach. You've just breached data. You've got to report that to the covered entity. That has to get all the patients have to be notified, which is very expensive, and you're probably going to be on the hook for that. And there are going to be penalties, and after September 23rd, you're the one that could be fined for that. So this is huge. So you have to have these things in place, or else anybody you share the data with is a data breach.
Well, you earlier said that you have to sign an agreement with the covered entity and the vendor behind you.
Correct.
Do you then, in pursuing the subcontractor responsibility chain, have to get copies of all those agreements?
Well, so the
records or for the covered entities records?
So the question is, if you're going to sign only with a person in front of you and behind you, and there are multiple subcontractors behind you, do you need to have copies of all of their records, all of the sub-agreements? The answer is there's no requirement for it, but now let's talk about what's best practice and what's going to protect you in an audit. So first of all, now you've got your agreement with your client in front, the covered entity, and that has certain requirements in it. Any requirement with a subcontractor, in my feeling, should include a requirement that they have to provide you with whatever you ask for in terms of those agreements. You don't necessarily have to collect them all, but you have a right to audit, and they have to prove to you that they're compliant because there's so much on the line. So this is one where I would put some language in what I would call a sub-BA agreement that would say that you have the right to audit. Okay, ensure that they're going to sign the BAs, monitor, and again, bottom line, any data you share with them is a breach. So recommendations: include all the required language, add language to include the right to audit, demand proof of compliance, report breaches in enough time to meet federal and state guidelines. So I'm assuming, since we're in Chicago, that there aren't people here from California, but your agreement with the contractors behind you and the subcontractors, if you were in California, would not say 60 days to comply with this, or even 30 days so we can comply with a 60-day deadline. It would say like 3 days so you can comply with a 5-day deadline. That's really difficult to manage. And I'm putting in here, I would say no later than July 1st, you have to identify who the vendors are you're going to be working with. And if you aren't confident and they're dodging you, or they're saying we're going to do something, we're working on it, we're talking to our lawyers, we're working with consultants, and they're not giving you a real answer, you better change, because again, you can't wait till September and then find out you got a problem. And then any data that you stored would be a data breach. So now let's talk about the HIPAA risk analysis. This was a question that keeps coming up. HIPAA risk analysis is section 45 CFR 164.308A1, and all I want you to care about is A1. It's literally the first requirement of HIPAA is a risk analysis. It goes way up into that security management process. So this is pretty simple in some ways. It's difficult when you get down and start doing it. But the first thing you have to do is you have to identify all the locations of PHI. So now we're talking about a medical organization that requires this, but it also is going to apply to you in your organization. Now they're going to have PHI and ePHI all over the place, and you're going to have it more isolated, probably through your service delivery function. So either your people are going to be touching it when they're outside, but if they bring it back into your office, it's going to be in a service area because they brought a computer back for a repair. Or your help desk may link in and open a session with a healthcare client, so they're looking at it on the screen. So those are the things that you need to be looking at so that you've got the protection of the data where it sits. So we identify all the locations, servers, local PCs, including laptops. Now think of the, quote, non-traditional areas, smartphones, tablets, thumb drives, all the other places, any media. Identify all the routes that ePHI follows within the organization and in and out of the organization. So within the organization would be a LAN or a WAN if they have multiple offices, and then outside the organization would be to payers, vendors, business partners, whatever. And then you have structured data and unstructured. Very simple. Structured data is in a database. So it's in a patient care system, it's in a practice management system, or an EHR system. Unstructured data is all the rest of the stuff. Microsoft Word documents, Excel spreadsheets, emails, all these different ways that stuff can move around, wherever there's a separate file. So you identify vulnerabilities. Vulnerabilities are just weaknesses. What things could happen? Systems that aren't patched is a vulnerability. No antivirus on a computer is a vulnerability. No firewall. Untrained users. No data backups. Single internet connection. Weak power grid. These are all weaknesses. So you identify what the weaknesses are, and then you identify what the threats are. So what could take advantage of one of those weaknesses? So they could be natural, like a hurricane or a tornado, whatever. Those are the ones we think about. They're in the newspaper, and they're the big ones. Then you have man-made. So equipment failure. So a vulnerability of not having a backup doesn't matter, but if the server fails or a hard drive fails and you don't have a backup, you just lost the data. So your threat would be the equipment failure acting on the vulnerability. Malicious behavior, theft, lack of training, lack of security.
I think it even goes beyond security and just the ability of the practice to deliver services. So even the death of a principal in the company.
Well, that's correct. Now, here's the difference. What you're talking about is at a different level than what HIPAA requires. So HIPAA requires you to do this when it's tied to the protection of the data, and what you're talking about is the protection of the practice. So that, in our business, at Seminole Consulting, that's the difference between when we're working on HIPAA to be compliant versus do you want something that's going to help your practice survive or your business survive. So yeah, but when it comes to this, we're really focused on the protection of the data. So yes.
So, are you looking at that chart? Are you saying all medical practices now should have 2 sources of internet? Is that part of the requirement?
Well, first of all, it's not a requirement, but here's the thing. When it becomes, well, let me ask the question, answer the question a different way. The question was, do all medical practices need 2 connections to the internet? The answer is no. But if you're going to do cloud-based EHR, now you've got a single point of failure with a single internet connection, and now you can't access your patient data without it. So that actually would tie in, and I would say from a HIPAA standpoint, I would think that an auditor might find you in violation if you lost access to your data for a period of time and there was a complaint, and you came in and you said, well, you know, I was too cheap to pay $50 for a second internet connection, something like that. So now you have vulnerabilities and threats. What are the weaknesses? What can act on them? What's the likelihood of a threat occurring? Now, you can use historical data. You can get information. You can kind of do seat of the pants guessing with personal experience. But here's one of the things. The one thing I'll tell you when it comes to the weather is that if you haven't noticed lately, folks, the past is no longer a good predictor of the future. Weather patterns are just all over the place. Hurricanes used to be from Florida up to the Outer Banks in North Carolina, and the last 2 big ones hit New York, Connecticut, and New Jersey. So you just got to be a little careful when you're doing that. Now, impact of the threat. So the likelihood and then the impact. Is it patient care? Is it life or death? Those would be the big red flag ones. Financial, productivity, notification costs, and financial penalties. Reputational, regulatory, or career. So you take the vulnerabilities and the threats, you identify them, then you identify the likelihood and the impact, and you basically come out with a threat matrix and that says here's what the risk is. Now, how many people here are familiar with the term meaningful use? So HIPAA has a risk analysis, 164.308A1. Meaningful use has a requirement for a risk analysis that complies with 164.308A1. They actually tell you that. They don't put the word HIPAA in there, which to me is a little frustrating, because when I've said to people, I need your HIPAA risk analysis, and they say, well, we haven't done one, you know, that means that they're kind of in violation, but it's also the message that you should have had this, even if it's an old one, you should have had one. So meaningful use core measure 15, which is to get the EHR incentive money, requires a HIPAA risk analysis. So we need it for HIPAA. We also need it. So this is a little different. They call it a security risk analysis. It's a little different than a HIPAA one because now it's going to focus on the EHR system specifically and how the data is protected. So we've got the risk analysis. That's the #1 on the hit parade for HIPAA. HIPAA policies. So what's a policy? A policy has to be vague, but you want it specific to a HIPAA rule. We refer to the CFR sections in all of our policies. We don't write a policy that says we're going to protect malicious software, period. We're going to protect malicious software in accordance with HIPAA 45 CFR, whatever. We use similar language. So we don't make any auditor or anybody that would come in try to guess that this is a HIPAA policy, and we want it vague so we don't have to change it very often. You don't want to be changing your policies. Now, here's why. For us, small businesses, I ran a small IT company. If I wanted to change a policy, I'd get everybody in the room, say, our new policy is nobody's going to do this, whatever it is, and send them back to their offices, and that policy was in effect. But when I went to work in a hospital and I wanted a policy, I had to get 8 signatures from department heads and people within the hospital. The CEO had to read it at a board meeting, and then it had to be voted on at the next board meeting. So it was a real bear when I was in a healthcare organization. So we really separate these. And then we have to train people, and we don't tell them what the policy is, we tell them what the behavior we expect, which will comply with the policy. So policy example says, ABC medical practice will implement procedures for guarding against, detecting, and reporting malicious software in accordance with, and that's the HIPAA guideline. That's as simple a policy as you can make, and we don't have to change it if we change a procedure. So now let's talk about procedures. So procedures are specific how-tos to comply with the policy. This is what we're going to do to comply with the policy. So going back to the hospital that needed all these different signatures and rules and all this stuff, when we got the one put in that said we're going to protect our devices against malicious software and it was signed off on, it didn't tell me how to do it. So I was using a particular antivirus solution, and when I switched to another one, I didn't have to go back to the board for approval. I simply put a budget request in through the normal business side, and it was approved. So that's where we include the details, the tools, the systems. We don't rewrite the manual. We generally say, here's how we're going to set it up. So in the case of an antivirus, we're going to set it up, or an endpoint protection they call it now. We're going to set it up so the users can't interrupt scans. We're going to set it up so we can manage it centrally by a console. We're going to set it up with current subscriptions so we always have active definitions. And then you have to change your policies whenever something changes. HIPAA says policies, procedures, awareness, and training. So awareness is reminders. Awareness is not training. Awareness is reminders. So you want to keep security top of mind. You want to continually reinforce the desired behavior, and you can do it by putting up posters, using messages on login screens. This is something that I see a lot of IT companies that work with healthcare miss, that when you're setting up the network, you can have a message appear when people go to log in. And you could put a message on there saying that the authorization, that the users are only to do authorized activities on this computer, that they're not to violate HIPAA or any of the local regulations and things like that. So that's a message. Now, that's not something, it's not a policy that they're going to sign, but that's a reminder message to them. And then verbal reminders. At every staff meeting when I was CIO in a hospital, I would stand up and give a quick security message to the other department heads that I wanted them to pass along. So here are a couple of examples of awareness messages. The left picture, the color picture, is of a monitor at the U.S. House of Representatives dining room. And it's got this ogre, whatever he is, surfing on a thumb drive, and then the guy that looks like a criminal sitting at the computer, and it says, safeguard your flash drive. And at the bottom it says, use only secure flash drives, for storing information. So the good news is that at the top level of our government, they're reminding people to do the right things. But when you look at this, it's really a very basic message to people that's just reminding them. And they're reminding them, in this case, with a colored cartoon that's kind of funny. I had this poster up in the cafeteria, in the elevators, and other things with the zipped lips. And it says, don't share your password with anyone, even the boss. Now, how did we kick off that campaign? At one of our department head meetings, I went to our CEO and said, Don, here's what I'd like you to do. And he did it. And he stood up and he said to the department heads, if I come to you and ask you for your password and you give it to me, you're fired. And if I come up to any of your employees and ask them for their passwords and you give it to me and they give it to me, you're fired. Any questions? And it sent the message that there was no reason for anybody else in the organization to know a password. If people called our help desk and said, I forgot our password, we'd say, okay, here's your temporary password, and we'd set it to change the password on the next login. So there was never a reason to know anybody else's password. But we actually made that a campaign. Here's another one. How simple could it be? What you see here or hear here stays here. Now, this is one of the challenges, by the way, that I think people in this room have compared to people that are working in healthcare full-time. And that is, and I've worked in healthcare a long time. Before I was a CIO in a hospital, I worked in an emergency room for 3 years. So it was kind of instilled in me that what you see here and hear here stays here. But when your folks are out there and they're not healthcare professionals, and this hasn't been part of their basic training and part of the culture, they need to be trained. And this is some of the training that has to be done to get your people to understand what their behavior needs to be at a healthcare organization and what they're allowed to bring back and what they're not allowed to bring back. So here's what you want to do. Training. Now, this is different than awareness. Training is teaching desired behavior. You don't have to teach them your policy manual. You don't have to tell them even, in some cases, these are policies. This is what you're to do. and we train you on how to do it and sign off here that you've been trained. That's all you're responsible for. This isn't a quiz about HIPAA policies when we're talking about the workforce. This is to know that they're doing what you want them to do and what you need them to do. Existing staff. So every place you go, your organization or somebody else's, they have existing staff. You could do HIPAA training in a lunch and learn for the existing staff and just get people to sign in and keep a record of that. The challenge becomes as new people join the organization, and even with your organization, which is an IT company, you're going to have the same thing. You have existing staff, get all your engineers and techs together and say, here's the training. But then as you bring new people in that are going to be working with you in a help desk or a technician or an engineer's position, you got to have those people trained and signed off on. And we're talking like a half hour's worth of training. We're not talking about go to school or get a 5-hour, 6-hour certification class. You've got to get everybody trained and signed off on before you give them access to protected health information. Keep the sign-in sheets, keep records in the employee folders, and then repeat this annually. There's no specific requirement to do that, but it's another one of those things like OSHA training and these other things. Get in the habit of doing this stuff on a regular basis. It'll reinforce what you're doing. It'll also give you stronger records to use if you're audited. So here's some quick things. This is training, and this is an example of training for technicians, for instance, on ePHI. Never send any protected health information by online email, such as Gmail, Hotmail, Yahoo, or AOL. Never mention or show patients on social networking. As dumb as that sounds, it happens. Nurses, I mean, when Facebook came out, nurses would take pictures of newborn babies and say, I just delivered this baby, he's so-and-so, and he weighed 6 pounds, you know, whatever else. It's like, what? It's a HIPAA violation. Never send any PHI by text message. Text messaging is, now we're talking about traditional text messaging through the carriers. There are now some services that offer secure text messaging. It's the least secure way of communicating, and if you don't believe me, go read about Rupert Murdoch and all the scandals where his reporters hacked into text messages. So this is the type of thing that we want to train people. Never copy ePHI to an unencrypted thumb drive, portable hard drive, or unsecured online storage. And the reason we say never is technically there's no rule that says you shouldn't do that, but what you've done, because these are just by nature portable and thumb drives are so small and can fall out of pockets or carrying cases, that would be a data breach. So we're trying to instill this behavior. Never leave devices containing ePHI unsecured. So if a tech picks up a computer from a doctor's office and is going to bring it back to the office, they shouldn't, you know, stop for a beer with their buddies and leave the car outside with a laptop sitting on the back seat. As bad as that would be because somebody stole a laptop that belonged to a client, it's a lot worse when it's health records and you now have to report a data breach and somebody gets fined $1 million. So this is the type of thing. So this is training. And then I said, remember devices like digital audio recorders, because when people are speaking into these audio recorders now, it's a computer. Their voice is now coming through an input device, not a keyboard or a mouse, but they're putting words in onto what? Electronic storage, and then it's probably going to get transmitted. Mark?
Don't you have to leave the drive on site if you're going to repair?
You don't have to leave the drive on site, but we're going to talk about that as we get further, some best practices. So training, and this is where 4Med comes in, and this is some of the stuff we've talked about. This is for you to be able to buy and also to be able to resell. So for executives and managers, they want to take the in-depth HIPAA course. You want people that have an understanding of HIPAA. For the workforce, you don't, I mean, in some cases you really don't want that for the time, the expense, and you're also giving them information they aren't going to necessarily use on a daily basis. You want to teach the behaviors. So you've got 2 different courses that are available, and the reason I put Reflection up there is that Reflection is an online mail security service. They're going to be here at the HIPAA Summit, and they offer you a discount for the training through their reflectiontraining.net. So now, delivering and documenting HIPAA compliant services. This will address some of the questions. So the first thing is that you got to protect PHI. And if you're protecting PHI, you're protecting yourself. So you got to treat it like gold, that even a small amount's valuable. Okay, now the bigger the amount, the bigger the risk, the bigger the fine and all that kind of stuff, but you got to get people to really, you know, be careful to understand that one record can create problems. If you breached it, it can create problems, relationship problems. It's not just gold, it's a hot potato. Be careful handling it. It's like electricity, respect it. None of us is afraid to plug something into an outlet, but we wouldn't plug a paper clip into an outlet, or most of us wouldn't. But what I'm getting at is we're not afraid of it, and we know it's dangerous, and it's sitting right here behind the wall. We're using it. The lights are on, the monitor's working, all these things, but it's something that we respect. You want your techs to think the same thing. Manage PHI at a senior level, ePHI at a senior level. I don't like the idea, and I just laugh every time I think of some of my old techs, the ones that didn't last. I don't want them making decisions on whether we're going to protect PHI or anything. If somebody's dealing with PHI, I want a call. If somebody's going to bring back a hard drive to the office, I don't want them to bring it back. I want them to call in and get my management approval to bring it back. I want to know that's happening because I want to know where they're going on the way. Okay, I want to know that it's coming back and it's going to get handed to somebody and being put in a locked cabinet. That it isn't just going to be thrown on the bench with all the other ones and all of a sudden maybe it gets given to the wrong customer. Okay, so we manage it in the practice. Make it important for everybody, and you've got to measure it. You've got to do some inspections of your own people, and when you find out that PHI, that they're working on PHI, go on back to the service area, say, okay, is there anything here that came from a doctor's office or whatever, and just track this stuff. So if they know you're looking for it, their behavior is going to change than if you tell them to do something and you don't pay any attention. So here are the things that we do. We do deployments and redeployments. So deployment, a new computer, redeployment, we want to move it from one place to another. So people call it moves, adds, and changes. Device disposal, and then repairs and upgrades. And I thought about it. There's not a whole lot that our company's ever done that doesn't fit under one of those categories. Okay, so you've got birth to death, you've got deployments and disposal, and then you've got repairs and upgrades and moves, adds, and changes in the middle. So what we did for healthcare organizations, we had checklists. We created checklists. So now everybody had to follow a checklist. The first thing that happened was if they did a service call on a device for a healthcare organization without a checklist, they weren't in compliance with us. That became a career discussion because they had to follow the checklist. We didn't want them to just hope they remembered everything. The next thing is 1 page per device. So if we were going to deploy 4 computers, we had 4 separate sheets that we filled out. Part of this has to do with what I call the thud factor. If we're going to get audited and investigated, I want to be able to drop the evidence down and have it thud when it hits the table, as opposed to here's a couple sheets of paper that show that we've been compliant for the last year. Okay, which one would you believe? What do you think the auditors want to see? We signed and witnessed things. Every tech would sign the work orders. Somebody else would sign that they witnessed their signature. Beauty contest kind of stuff. Then we scanned it into our ticketing system. So if you're using a program like ConnectWise, AutoTask, TigerPaw, whatever, most of these now, the ones that I'm familiar with, have the ability to like send an email to the ticket or scan a document right into the ticket. That's what we would do to store this stuff. So here's an example, a comparison between standard service and compliance service. This is simply a hard drive upgrade. So you have 2 tickets. If you're using one of the monitoring systems like Level platforms or one of those, you get an alert from a car repair shop that says a hard drive's full or getting full. And then you get the next alert from a medical office that says the hard drive's getting full. So what do? So when you go out to the car repair shop, you really only have to do a few things. You take the data, move it to the new hard drive, make sure it's working. Take the old hard drive out, bring it back, send them a bill. There's not a lot of work to do because they're not regulated. But now you take a 4-step process, and when you go to a healthcare organization, it's like a 10-step process. The first thing is use the checklist. Everything we do has a checklist because, again, we don't want people to get a phone call and forget to do something, or we don't want them to go out there and they forgot 2 things, so now we only did 8 instead of 10 steps in this, and we've identified 10 to be compliant. So we're going to do the same thing, transfer the data to the new drive. We're going to erase the old drive at the client site. Okay, we don't want to transport that drive when it's got data on it, but it has to be transported. We're going to get rid of it. So we're going to erase it at the client site. Now, you could even leave it there if you wanted to and tell them to get rid of it. But once it's erased, if you've documented that properly, you can bring it back. We're going to save the erasure report to the ticket. So the fact we erased it, again, I said at the early part of this, if you don't document it, it didn't happen. So we're going to document that we did it. We're going to save the erasure report. We're going to remove the old drive. We're going to track the transport back to the office. We're going to note that it was transported after it was erased from the client site, the medical office, back to our office. And then when we bring it back, we're going to destroy it. Now, destroy it in our case meant we had a drill press that had carbide tips on the drill bits. So we would drill out like half-inch holes into every one of these things. And, you know, people love doing it. They all wanted to, you know, drill out the drive. So you can use that as some little reward system. You know, whoever bills the most hours last week gets to drill out the next drive. But that way we destroyed it. Again, if it wasn't recorded, didn't happen, take a picture of it with a cell phone. So just hold up your phone, take a picture of it so you can now see light through those 4 holes. Send the picture, email the picture to the ticket. How long does it take? Now you've documented that it was destroyed, and then you have to get rid of it. So now you're going to send it to some company that shreds these or whatever. And what we did, because part of this is a beauty contest, is that we would send a report to the client's compliance officer that we did this real time. As soon as the process was done, we'd send them the report for their records as the compliance officer. So that got us a little broader and deeper within the healthcare organizations, because we weren't necessarily just dealing with a practice manager or even an IT person if we were doing this for them. Now at the bottom, I have charge $2 signs. So this is kind of like when you go out to the internet and you want to see if a restaurant's expensive, it has X number of dollar signs. So here, for the standard service, you can charge $2 signs. But when you're dealing with somebody that has to meet federal regulations and you go through 10 steps to do that, you can charge them $4 signs. You can charge them a lot more because you're providing them with a compliance service. Notice it's the compliance service as opposed to a standard service. They have no problem doing this to you, by the way. So they're going to charge you for something, but then if you need a special test or a lab report or a procedure, you're going to get charged for it. And if you have to go to a specialist, then you pay more for the specialist to do something. So this is something that in healthcare, as much as they hate spending money, and yes, we all know that, there's some logic to use here when we're trying to sell some of these services. So the tips. Isolate ePHI. This is for you and your organization to limit the risk of loss or unauthorized release. So keep track of it with your own within your own business, and the more isolated it is, literally physically in your facility and with a number of people, you have less risk. Do as much work as you can at the client site. If you don't bring the stuff back, you're not transporting it, you don't have the risk. Alert management when dealing with PHI. That to me is a big one. If you are going to have somebody bring something back, wouldn't you want to know about it rather than finding out later they lost it? And that's the first time you hear about it. Track the movement of devices. And then in our office, we had a secure cabinet. We had a metal cabinet with a lock on it that we kept memory and other things. And think of the jewelry, you know, the small stuff you have, the processors and the memory that are expensive. Put any device with PHI in the same area in the sense that it's locked up because you value that stuff. So now let's talk about HIPAA enforcement, security incidents, and reporting. An incident, not a breach, an incident is any potential loss or unauthorized release, anything that might rise to the level. It may be reported by anyone. There's no specific reporting. Even on the HIPAA websites and things, it doesn't say that you have to be a particular title. Anybody can report anything. You need to investigate it quickly, and I would say hard. I mean, really investigate this. Lost devices or breaches unless they're recovered. That's part of the new data breach rule. And the exceptions would be if there's forensic proof that the data was not accessed, but that also assumes that you got it back. Okay, it wasn't true. It wasn't lost completely. Data breaches. These are examples. Loss of an unencrypted device that contains ePHI. Improper disposal of PHI, which is not electronic, or ePHI, which is PHI sent to the wrong patient. Telling a friend or relative about patient information. Theft of patient data to defraud payers. Selling patient data to personal injury attorneys. That happened near us in Las Vegas. Posting ePHI on a public website is dumb as that sounds, there are breaches where people have done that. And snooping in patient records. Again, you have all the authorization to be in the system because of your role, but now you're snooping in other patient records. So these are all data breaches. What are the penalties? Here's what you need to care about. The top penalty for every violation is $1.5 million, and you can have multiple violations, multiple different violations in the same breach. So there was a breach last year. We'll talk about it here in a second. There was 1.7 million. Okay, $1 million is a lot of money, folks. Now, here's what's not on here. These are what the penalties are. This is the fine that you will pay to the federal government once they determine what the incident's been and that it's a data breach and that you meet the requirements for penalties. This isn't what your cost is, because you're still going to have to implement the proper compliance, which they require to be audited by a third party, and you're going to have to pay for the notification of all those payments and of all the patients. I've seen numbers upwards of $200 per patient for notification.
This doesn't include possible state violations.
Yeah, no, this is federal. This has nothing to do with state or any other. What was the question?
Texas has basically mirror any violation charges for the federal. You'll get it from state mirrored.
Okay, so Texas is like doubling whatever the federal violation is. Okay, but this is real money, folks. Okay, the risk is huge. So now, here's reporting. Data breaches of more than 500 records, and it's actually of people in a state, must be reported to OCR within 60 days, but then I told you California now has 5 days. If it's more than 500 records, it has to be, I'm sorry, this is a mistake. If it's fewer than 500 records, that's a mistake on the slide. It has to be reported to OCR in an annual report. So it's still reportable if it's fewer than 500 records, but you do that on an annual report. I'll fix the slide. Patients must be notified directly if you can reach them, if you know who they are and how to reach them. If not, you have to go through the media.
In my reading of the law, it looks like there's two kinds of risk analysis. There's the security risk analysis, but there's also a data breach risk analysis that you have to do when you become aware of a breach.
That's correct. So data breach risk analysis, and go back to where I said those exceptions where you can do the forensics. I kind of skipped over the fact that that's part of a risk analysis after a breach. So that's one of the examples. But yeah, if there's a data breach, then you do a risk analysis afterwards. What you're trying to determine is the extent. Now it's of the breach. Okay, it's not going back and doing the risk analysis you should have done for your practice. Now it's a risk analysis specific to the breach. What was lost? Who are those records? You know, where are the records? What's the likelihood that they were used against you or accessed, basically? Okay, so now. Last year, the HIPAA police woke up. From 2005 to 2011, very little enforcement. And then when the HITECH Act got passed and the money got funded, they funded enforcement. This gentleman, who's I think doing a great job of enforcement, is named Leon Rodriguez. He's the director of OCR, the Office for Civil Rights. He's a former federal prosecutor. The guy wakes up every morning wanting to prosecute somebody. So in 2012, they started enforcement. Over a year ago, a small medical practice, 5-doc practice in Phoenix Cardiac Surgery paid $100,000 for sending email through webmail, okay, patient information, and they were using an online calendar for scheduling. Now, this isn't specific, but would you, I mean, I'm not trying to insult them, but would you trust Google with your patient data? Why is Google email free? They data mine everything. So you don't want to be sending patient data through Google. Alaska Health Department, State of Alaska Health Department, $1.7 million for a lost hard drive. Massachusetts, so I don't know if you're familiar with Massachusetts. Massachusetts Eye and Ear Infirmary, which is part of Harvard Medical School, $1.5 million for a stolen laptop. Idaho had a small hospice in North Idaho pay $50,000 for a lost laptop, and they still had to pay the notification costs and everything else. And these things are all published on that HIPAA data breach wall of shame.
It's my understanding that what they really clobber you for is the willful ignorance.
Right, willful neglect. So here's what they do. They go in and they investigate the incident. Call it a triggering incident. The lost laptop's a triggering incident. As they're investigating this, and they find out you never really implemented a HIPAA compliance program, that's going to increase your fine compared to if you did everything right and it was like an accident. Think car insurance. If you buy car insurance and you have an accident, you know, somebody hits you, whatever, they're going to pay. If you have the same car insurance and you drive a couple hours to Indianapolis and you make a right turn, or like be a left turn coming out of Gasoline Alley into the pit lane on Memorial Day, and you hit the first turn wall, you have car insurance. Do you think they're going to pay? Okay, no. So willful neglect is saying we've not done anything to comply with HIPAA, or you've not done anything, and that's why your fine's so great. So let's run through some things quickly here on monetizing healthcare IT. So you want to position your company. Compliance services versus IT services. You want to talk in healthcare lingo. You don't want to have to teach healthcare people your lingo. You'd rather talk in compliance. You're going to be more successful talking in compliance lingo than trying to get healthcare people to understand how an online backup system works. If you tell them this will help you comply with HIPAA in these sections, that's going to be more meaningful to them than if you tell them how the thing works and how fast you can recover them and all that stuff. Certifications, market, market, market. Everything I do, you see my business card, my website, my email signature has my certs on it. Sell training. You don't have to do the training. You've got it right here and you can resell it, and that's a service that they need. What more could anybody ask for? You don't have to do the work and they need it, and you can make money off of it. Sell healthcare IT products. So when you go to the summit and there's the exhibit hall tomorrow, look for products that can help you comply. Email security, IT security, firewalls, and those things. Avoiding healthcare acquired infections. There are companies that do like keyboards and mice that are antimicrobial, and even though, you know, you kind of like to think more technical, that can help them avoid some new rules and new penalties for infections. And of course, join the 4Med network. This is to position yourself. Opportunities. Email encryption, endpoint encryption, secure email systems, compliant online backup, compliant deployments, compliant services, not managed services. I'm saying rebrand your stuff, not to do managed services. End user awareness and training and outsourced compliance services, which we offer. 4Med network, I know you can't read the slide. We've got documents here that explain the different levels, and that's also available on the internet, and contacting anybody at 4Medapproved, they'll be able to help you understand what the different levels are. You can sell, we have SaaS, HAS, hardware as a service, IaaS, infrastructure as a service. Our company, Semel Consulting, through 4Medapproved, offers compliance as a service. So we've got different services, assessment services, compliance management, and so forth. You can resell, and the value bundles will discount those. This is like McDonald's, folks. We've got the individual services, and you can combine 4Medapproved training, Falcor's, or Assured IT's technical stuff and our stuff, and you get the Happy Meal. What do you need to do by September? Work with your subcontractors or replace them, create written policies and procedures, get HIPAA certified, train your workforce, and develop compliant service delivery. It's a simple checklist. It's hard to do. There's a lot of work involved there. So what we've done is our company's doing some workshops. We're doing one here in Chicago, June 7th, where you get the tools for your company. You get your policies and procedures, training for yourself, and then moving forward, because like with any workshop, as you start to develop these things between now and September, you're going to have questions. We're including consulting. So you can send us policies to review. You can call us. We're going to do some coaching calls and things, pushing it forward. So for $9.99, you can attend a one-day workshop. It's going to be at the Hyatt Rosemont, which is where the ASCII event's been in the past, and we negotiated a $129 room rate. So that plus $199, you got to get here. Free parking, and we're providing lunch and breakfast. And we just did one last week in Dallas and got some really excellent reviews. So this is something where you can really jumpstart a program if you need help doing that. So here's the quiz. Who can answer this question? What does the second P in HIPAA stand for? Ignorance. Okay. There is. Oh, go on. whoops, sorry. So spell HIPAA correctly or truly, it can affect your credibility. And I see this happen all the time. Companies that say they're providing HIPAA services or they have a HIPAA compliance program, they spell it with 2 P's. So the first time I used this slide was actually during the playoffs. So everybody was thinking basketball, and unfortunately my team made it to the Final Four and didn't get past that. But if you just think of it as, if you think of the basketball with NCAA on there, it's going to remind you, just trigger that HIPAA has 2 A's at the end, and you're going to spell it properly. So I know we've answered a lot of questions during this. Are there questions that anybody has that we didn't answer?
I have an associate that's an IT provider who has a client that is a medical examiner. And it's interesting, the law does cover the protected health information of those deceased persons for years.
50 years. So they just quantified that in the new HIPAA Omnibus. So the question was medical records for people that are no longer living. So they've now said, first of all, they're only protected for 50 years. Seems like a long time, but at that point they won't be. And there are also some specific rules on being able to share information with decedents that are in there.
And then as a follow-on, and with due respect, I have to challenge that assertion about people who take cash payments not being covered. Why would the medical records of their patients be less protected than those of patients who go to practices that bill insurance?
Well, I think there's 2 answers to that. I think there's like a moral question. The question was, what if a doctor's office, for instance, only took cash payments, why don't they have to protect the medical records as patient or as practices that take electronic payments? It's that HIPAA very clearly has a section called, are you a covered entity? And one of the questions asked is, do you bill electronically? So the original law was written, again, for insurance, health insurance, portability. Keep in mind, this was tied to the insurance business, or the insurance process, not just the insurance business, but it's tied to the money flow. So I'm not going to answer the moral question. Morally, I think all the records should be protected no matter what. But, and that's where some of the states have come in and said this, HIPAA does not cover everything, so we're going to cover more. But go back and look at are you a covered entity? And if they say, no, we don't bill electronically, they're not a covered entity, covered by HIPAA. Other questions?
We have.
I'm sorry.
So I have a question about a reseller. So you're going to resell those online training classes. What kind of discount are you getting?
I'm going to defer to one of the 4Medapproved folks. What's the discount, or what's the?
I saw that one class shows like $2.99, right? So what kind of a
So that's for
discount?
reflection, like if you are a partner with reflection. So the question was about the discount for the training program?
Yes.
If she's a
So
reseller.
actually you are recommending that we resell those training,
Yes.
Yes.
online training to the doctor's office, you know?
Right.
Yeah.
Here's the way it works is those programs retail, and it's a little bit different for workforce training because there's volume pricing. But say for the security officer training, the course retails for $449. We wholesale it to you for $199, and then you're able to set a discount for your customers at any level you think appropriate between those. So typically we suggest 20%.
But Brian, you have to buy a quantity at $199, or you can buy them one-off from Reflection at $299, right?
I'm just speaking of the resellers.
Right.
I'm not sure what your question is.
Don't you have to agree to sell 200 to get the $199 price? That's
to get that pricing, but it's
Yes.
not upfront, and you're not required to buy the outstanding licenses. So it's more that then in the second year, you don't need the 200 licenses. It would change the amount that we wholesale it to you. But the basic version is we wholesale it to you for $199. If you set a 20% discount, your clients get the course for, it comes to $360. So it's a significant discount from the retail, but you also then make the margin, so that would be $160.
And I just want to clarify, clients cannot buy this training directly from Reflection. You have to go through the reseller.
They can buy the training through Reflection through us. It's our training, but Reflection is a reseller of ours.
You have to be a reseller partner in order to get that discount price. So you can't just say, oh, I want the Reflection price. You need to be a member, a Reflection partner.
but a client can go directly to you to buy the training.
At 449.
At
So the client may be
Got it.
paying full
Yeah.
price,
I understand.
right?
But right, so your
That's-
clients would get a significant discount, which we don't offer from our retail pricing. That's for partners only.
So it's $449 to the client.
Yes. Right. If they buy it directly from us, the retail price is $449.
But if it was your client, it would typically be $360 to the client.
Exactly.
Okay.
That's great.
In summary, the published price on your website is $449.
Correct. Thank you.
There you go.
Okay. Any other HIPAA questions? I can answer those.
I have a question. Back to business associates. If an attorney is defending a hospital or a doctor in a malpractice suit, they would be a business associate.
Yes.
What about the attorney defending the person filing the suit, the patient,
Well, they're not defending them, but representing them.
representing them?
Okay, so here's the thing. So the question becomes the two attorneys in a courtroom, like a malpractice suit. One's representing the patient, the other's representing the entity, the doctor's office or the hospital. The patient has requested their own medical records, and they can release them to anybody, and that's not a HIPAA. Getting the medical records is a HIPAA request. They can give it to anybody, including their attorney. So that's not a HIPAA transaction. Now, keep in mind, we're talking attorney-client privilege and other things that will kick in terms of protecting that information. But the healthcare organization has to give it to their attorney to represent them. That's a business associates agreement relationship on that end, because they're giving it to the their specialist or their advisor, their attorney to represent them, to protect them through their operations. So it's part of TPO.
Okay.
It's not part of treatment, it's not part of payment, it is part of operations to protect them in the lawsuit.
So the patient's attorney would not be a business associate necessarily.
Not of the patient, but tomorrow they could represent a doctor in a case and they would be a business associate in that situation.
Back to the first instance, what if the attorney that's representing the patient subpoenaed other records from a doctor's office?
Well, here's what it gets down to. If the patient is releasing the data to their attorney, it's not covered. If the other office has to release it to an attorney for a particular reason, that is covered by business associate relationship. That would be. Okay.
I'm going to read a couple questions from that have been posed from the people that are remotely watching our webinar, if that's okay, and then we can address additional questions from the audience as well. Let's see. Did Google and Microsoft state that they would not sign business associates agreements with any covered entities?
No. What my understanding is that Microsoft has specifically stated they will sign business associate agreements, and I have heard that Google hasn't. I've not seen any statement on their part.
Do what you refer to as drilled hard drives meet NIST 800 clear and purge requirements?
I don't believe if you just drill it. What we've done is we erase them using the software that meets the NIST standards, and then we destroy them.
What if you can't drill them or can't erase them?
If you can't, well, there are different ways of erasing them. So this becomes a technical question. If they can't read the drive, okay, there's still data on a magnetic platter. Now, there's a different answer, by the way, now as we're moving to SSDs, because we have different situations. But you can get degaussing tools that will just put a huge electrical field across that drive and erase everything on it, even if it can't spin. So there are tools that you can get to erase drives that won't spin.
Okay. Is it correct that data retention requirements for health records are determined by the states and not HIPAA?
Well, there's two answers. First of all, it's not HIPAA that requires them, it's Medicare. So Medicare has its own data retention requirements. HIPAA has some, but for your evidence and things like that. But really, it's the states. There's a whole list of state retention requirements, and obviously the first state on the list alphabetically would be Alabama. And Alabama has a requirement where for birthing centers that they have to keep the records for 7 years after the patient reaches the age of majority. And in the state of Alabama, age of majority is 19 years. So in Alabama, they have to keep records for 26 years in that specific requirement. So states have their own. There are also federal guidelines for retention, and like I said, Medicare has theirs, and there's some others.
Do we have any other audience questions? A couple more from the audience?
So if you're approaching your client with this information and the compliancy and you're not aware of it, and they flat out just will not comply. Did your slide earlier say you're done with them, or because we're now at risk for those fines, or?
Well, if there's no, I mean, you're not at risk for their fines, but you would be at risk for your own fines if you did something that didn't comply. The question is, are you done with them because they're not in compliance? Not necessarily. I mean, you can still provide them with services, but I'd be very, very careful in terms of what I did and all that. I'm sorry, there was one other question, I think.
Yeah, we use PSA and RMM tools to manage our clients' networks, and we've given them the ability to send screenshots to open up the ticket. So there's that risk that they could be opening up a screenshot with PHI on it. That would be stored in the RMM or PSA tool doing business associate agreements with those providers as well.
I would say yes. So the question was, so I'm going to translate this to people that may not be familiar with the terminology. RMM's remote monitoring and management, and PSA is professional services automation. So an example of RMM would be like Level Platforms and Enable and LabTech and those. PSA would be Autotask, ConnectWise, TigerPaw, using something different? ConnectWise, okay. So part of my question would be, if you're going to put data in there, now you've got two questions, because in some of these cases they offer hosted services as opposed to local. So now if they're going to send a screenshot that has this, I would make sure that the provider does sign a business associate agreement, and I'd also tie it back, even if it was local, to the idea that an EHR software vendor isn't a business associate because they wrote the software, but because they support it. If you're ever in a situation where, in your case, ConnectWise has to move a data file or whatever, keep in mind that data file would have patient data in it, and you'd want a business associate agreement with them. I've never talked to the folks, and I believe they'll be here. So talk to the folks at ConnectWise, and they know me, send them my way if they don't know much about HIPAA and need some help.
If, let's say, for example, I've got a client who's a medical client, and he's poo-pooing this whole thing, he doesn't care, but we become aware of a possible breach, like, for instance, his wireless network is wide open and it's connected to his systems. Are we under any obligation to report them?
Well, technically, there's a thing in HIPAA that says that if they're, first of all, let's talk about you for a minute, that if they believe that you're doing something that's not legal or not compliant, they're supposed to alert you and then terminate the relationship. And it even says they're supposed to report anything that you've done that may rise to the level of a breach. Now, having an unsecure wireless network is not in and of itself a breach. The data has to be breached. Okay, that's the vulnerability. So yes, I would be wary of that. I would inform them. I'd document the heck out of it. But there's no breach by having the open network. It's the vulnerability.
But if we became aware of an actual breach that they were covering up or something, are we then obligated?
Well, technically yes, but here's the other thing that happens. If you're aware of a breach and anybody that sees that can report it, now what's going to happen, and this is going to happen soon, is that people will be able to share in the fines. So it's going to be like the False Claims Act. If you follow the Lance Armstrong thing, he hurt an awful lot of people, right? Well, one of his former teammates, Floyd Landis, filed a claim against him through the False Claims Act, where saying that they defrauded the federal government when they sold the sponsorship to the idea to the Postal Service for like $40 million. Well, if Lance loses, it's triple damages. Floyd Landis will get 10% of that. Okay? So you're going to start seeing more things, and what we feel, because it's not clear because you can't tell where these complaints come from, but I know of a very specific circumstance where it was a disgruntled ex-employee that turned in the boss. So if these things are, if people are aware of them, there's a lot of risk that it's going to be reported now.
What about devices leaving the facility? They cannot leave the facility.
I'm not, what's your question, Mark?
Like an iPad, somebody wants to take their iPad home that works, has access to medical records, has medical records stored on it, they take it home.
Well, first of all, those are two different things. If a device has access to it but doesn't have it on it, then if the device is lost, if the access is protected, as long as there's no password and logon taped on the outside, then it's not going to really open up a breach. If it is lost, then you've got a presumed breach. So again, it's not specifically outlawed by HIPAA, but now you do a risk analysis. What are the odds of somebody losing a smartphone or a tablet compared to data that's on a server? So that's where you can go out and sell them on remote access tools, whether it be a Citrix or some virtual desktop environment or something that they could get to where the data isn't stored on the device or a laptop or whatever, but they can get to it. Now, there's another thing. So this is part of training, true training, and it's called situational awareness. So one of the first speakers today was Kevin Donnelly, who's the CEO of 4Medapproved. Kevin emailed me one night and said, Mike, I'm on a flight from LA to Chicago, and I can see patient data between the seats because the doctor in front of me logged on using the wireless internet in the airplane. He's updating patient records. Now, come on, folks. Situational awareness says just because you can do it doesn't mean you should do it in some place that's not secure. So he probably had a very secure device. Maybe he protected his password and, did all the right things. And then the guy, and I don't think it's rude to use the term idiot. This is one of these things where he made a bad decision. Come on, it wasn't smart to take a device that's secure and take patient records that are protected and turn them on in an airplane where other people can see it. So, and there are even things you can put on the screen. They're lenses, essentially. It's almost like polarization, where when you're straight in front of the screen, you could read it, but that person in the seat behind you. Now, here's the thing. In Kevin's case, because I fly all the time, he may have been lined up enough that he was seeing the same thing the doctor was, even with that kind of protection. So I'd be aware not only of the type of devices what it is, but I'd be telling people, even if you're going to use a secure device, make sure you use it in a secure environment. So, any other questions? Yeah.
Okay.
Well, no, I'm sorry. We had one.
I'm sorry. Go ahead.
Getting back to a PSA question, if you're not storing any pictures or any health information in a hosted PSA system, but you are storing the passwords to the end user server or their router, even, let's assume that they're using an EMR system that we don't have access to. They do, we don't have the passwords, but we're storing the passwords to their servers, or they may have some Word, Excel, and things like that. Is that going to require a business associate agreement?
Well, it isn't, but you just opened up another half-hour conversation, which I don't have time for, seriously, on how to protect passwords and whether or not you use multi-factor tools for when you're accessing a client site. And by the way, I'm not even limiting this to healthcare clients. I'm saying any client. If you want to talk about that stuff, come see me afterwards, because there are some really good tools. And my first answer is I would never put anybody's passwords up in one of those PSA systems, period. There are more secure ways to store passwords. Okay?
Okay.
Thanks,
as
folks.
I said, we went over a little bit. I apologize. It's obviously a very interesting topic, and I want to thank Mike very much for his presentation today. I also wanted to let everyone know that you will be getting a copy of the slide deck as well as the recorded version of this webinar via email in the next couple days as we get the recorded version uploaded and that type of thing. That includes the people who are logged in remotely. There were several questions regarding that, so yes, everybody will get a copy of that. I appreciate your attendance today. We're going to close down the webinar now. We have a couple of housekeeping things for those people who are on site here. If you did not turn in a business card, we do have a raffle for an Apple TV. Please provide that to us. If you didn't bring one by any chance, we can get one of our cards and write it on the back. In addition to that, we do have the certificates of completion for everyone to take home with them, and the people who are logged in remotely will get it digitally.
If you are interested in becoming a reseller, we have information.
Yeah. Please
Spending
spend
the network as well.
Please spend the next 45 minutes or so just